Last time, we sadly left each other with this dilemma: to solve that damned anterior crossbite, or to tell the parents to prepare their daughter for surgery and for further orthodontic treatment. That was the question. I say, let's try to solve the crossbite. How? Easy. Lower interproximal reduction. I don't know why I did not think of it before. And in the meanwhile, the upper impacted premolar had erupted, showing actually a normal anatomy. From a rectangular wire I had on the upper arch, I slid it back to a 0.14 Q-Night tie to be able to engage it and bring it outward. Well, it did erupt, but it was rotated by 180 degrees. As you can see, that did not bother me at all. And as the upper and lower crowding were eventually coming to an end, I put a lot of attention not to screw anything up. That is why I kept making a tight band back in the lower arch at every arch wire change. That is mostly used in MBT technique, but it can also be useful in low friction cases where you need to prevent lower incisor flaring. At that point, I had to admit I was scared. I was scared of putting a rectangular wire, activating the torque on those lower incisors. I wondered, if I use high torque brackets, I might revive the anterior crossbite. If I use low torque brackets, I might damage the periodontium. So I just went for a final elimination of the brackets on the lower incisors, as I figured they were exactly where they were supposed to be. I then splinted from lower bicuspid to lower bicuspid and kept the third class elastic just on the right side to correct the midline as much as possible. And at the end of it all, this is what we get. No anterior crossbite, first class on one side and third class on the other, slight deviation of the midlines, and of course a great upper incisors inclination, which was needed to compensate the third class, but still some upper protrusion. And besides the lower splint, I gave Anya that terrible removable appliance to wear every single night for the rest of her life, to my concern. And this is right after debonding, at 15. Unfavorable growth, you say. Still a protruding chin, you say. What's gonna happen when she's 19, you say. And you're right, that was a bet. It could have ended worse, and everybody knew it. I just recently took some long-term pictures of Anya. 16 years, 1 year follow-up. 19 years, 4 years follow-up. Won the bet, lucky enough. Orthodontists, I'll see you next time.